Hi, I'm Julie. I'm one of the registered nurses here at Southwest Human Development, and most of our programs are home visiting programs. And as we get back into home visiting and socialization, I know many of you have some anxieties and fears about coronavirus, COVID-19. Let's gain a better understanding of what this disease is all about. Well, how it is contracted is through respiratory droplets within 6 feet of person to person, which means coughing, sneezing, heavy talking, spitting. Then somebody inhales it and the disease process starts to occur. Now here's the tricky and the mystery thing about this is that if somebody was exposed to COVID-19, they potentially could never ever show any types of signs and symptoms. So as we go around in the world, we may not know that the person next to us is a carrier and we could be exposed. But we gotta actually be more careful of those who have been ill. And as we schedule our home visits, we may need to ask a couple of questions in the developments of scheduling a home visit. If somebody was sick, they would usually have a fever, a dry cough, difficulty breathing, in some cases, a decrease in smell, taste, or GI upset. In order for them to no longer be contagious, 2 things must happen. One is at least 7 days from the onset of their symptoms. And number 2 is 72 hours without having a fever, without depending on medications, such as Tylenol or ibuprofen. However, if they had been sick, most of their physicians or even the health department is recommending that they stay home at least for 2 weeks in a quarantine environment. So if you're calling somebody to schedule an appointment and somebody has been sick, you may need to ask, when did they start getting sick and when would their quarantine 14 days be up? When was the time that they had met those 2 qualifications of at least 7 days from the onset of infection and 72 hours fever-free? And then plan your visit then after so that both you and the client is safe. Now, before you actually start your home visit, once you have your home visit scheduled, you will need to take your temperature before you leave the house and make sure that you do not have a fever yourself. If you do have a fever greater than 99 degrees, it probably is advised that you check in with your supervisor and again, postpone that home visit. In future videos, I'll be talking about how to use a mask and how to use gloves in order to be able to protect yourself during that home visit.